Good morning, everybody. Sorry for this technical issue. We didn't expect it. Welcome to this webinar, which is organized by the Learning Hubs. We are happy to see you in this webinar, which the thematic is CLM Maturity to our CLM Sustainability. As we know, community-led monitoring has gained significant traction as an accountability mechanism that empowers communities to identify barriers to accessing health services and partnered with health services to implement solutions tailored to their unique needs. So CLM is instrumental in sustaining, improving access to and the quality of healthcare services. And we see that the data generated through CLM efforts significantly enhance other monitoring and evaluation activities conducted by governments and donors. The Learning Hubs are happy to organize together this webinar and which aim to foster a discussion on embedding CLM in national health systems to ensure its sustainability. So the objective of the webinar is to increase understanding of the importance of CLM maturity and what this means for sustainability, and to present examples and best practices of advanced CLM programs from selected countries to highlight successful strategies and outcomes. Another objective is to encourage discussions to explore challenges and bottlenecks that hinder achieving CLM maturity and embedding CLM in national processes. And then to identify community priorities and needs of communities to support the advancement of CLM program to achieve maturity. Just to signal before continuing that we have some interpreters, but we are still trying to manage. But actually, for those who can speak French, the French translation is available. Pour les francophones, vous pouvez déjà choisir le canal interprétation et la langue française pour suivre le webinaire en français. So we will continue now with our first presenter, that is Suzanne Perez. Suzanne Perez is a specialist working on community-led monitoring in the Global Fund. She will present us a thematic on achieving CLM maturity and embedding CLM in national processes. Welcome to you, Suzanne.
Hello, everyone. Put my video on for a little bit just to go before I turn it off, because I think maybe the network will be better if I turn it off. So thank you, and thank you to the Learning for supporting very important and exciting topic, which I think is generating a lot more discussion these days as our CLM programs continue to and advance. We receive at the Global Fund a lot of questions about what we mean by CLM maturity, what do we mean by CLM sustainability, and how do we support these programs, reach these maturity and ultimately sustainable CLM programs. I'm really happy to be here. Thank you to the Learning Hubs and Ida and her team. And we'll just kick off. I feel like I have, 10 minutes, but now maybe only 8. So I felt like it would be really important to just remind ourselves how CLM sits with a broader CSS context. What we always like to point out, the fund and the CRG department, is that community-led monitoring an intervention carried out in isolation. It actually is supporting and supported by the other 3 CSS interventions. So when we look at community-led research and advocacy, this is really focusing on critical community driven through our CLM programs in advocacy, using that in research studies and assessments. At community-led monitoring to community engagement, because sharing this data and conduct advocacy, you are being and to engage, be involved in coordinating platforms and mechanisms. So we see a very linkage there. And then capacity building is an intervention that very much supports community-led organizations, community-based organizations, civil society organizations to build skills in any monitoring, in research, data collection, data analysis, all of the other skills and capacities that are in order to implement effective systems. Next.
Two?
Yeah.
Sorry, Niluka. It seems your connection is a little slow. So there's a little breaks here and there. May I request those who have their cameras turned on to turn off, and then we can try again.
Okay. All right. So, and then just please stop me, Niluka, if you feel like it's just still choppy, and we can do. So this is a very basic slide of 3. It's not very common. It was something I came up with in G6 to really understand the progression of CLM programs and how we are supporting them through this transition. So on the left, you see the program. And this is really where we're looking at building that CLM readiness. So building and securing commitment from government, generating interest from communities, and really just focusing on maybe budgeting and really trying to understand, is this an intervention that would be helpful in the country for the national programs and so forth. So we look at nascent programs and really at that readiness early stage. Then once they get set up, they're basically considered established. And this level of maturity is looking at these programs where there may be one or more approaches and they've done data collection, but where there are weaknesses in data analysis and don't quite see data is being used efficiently and effectively to see. And the highest maturity level is what we are an experienced or sustained program. These are very challenging and require a lot of experience. But these we consider are those that have completed at least one data collection cycle, and actually see evidence of results and greater evidence of this data leading to actual improvements in services. Arrows are just another feature because in GC6, we focus a lot of our support on helping countries to set up their programs. So we really focused on those nascent programs and to the established level. And now in GC7, we are out of these programs really digging into being established and then trying to move to this experienced program level of maturity. So that is sort of the progression of where we are to by the end of G. Next. This is showing a bit again of the cycle, which we've all seen. And what we focus on a lot in the maturity levels is are those or stages in the red circle. So really being really good at doing your analysis, which then allows you to feel confident in your dissemination, and then using that data in advocacy, and then monitoring, hey, we shared this data with our health facilities, with national authorities or national authorities, and we actually are starting to see actual changes that we are documenting and monitoring. The arrow left is then extending the cycle to what I really want to always know the answer to. We can say, in terms of changes, waiting times at the clinic have been reduced. The lab able to produce health are able to give results from viral load tests, for example. All really, really good changes before and then after STEM. But what we want to see and document is actually the changes in do we actually see uptake in services? We see more people virally suppressed. We see more people getting tested. We want to see those indicators change. So we see that those changes at the facility level in our accessibility and availability and quality of services are those actually then leading to ultimately our improved health outcomes. Getting to the experience level of maturity, we like to ask, what is your data story? Many times I see very, very, they have complete collection cycle and oh, okay, great. Like into this data. Slide, you know, a CLM implementer has done, next slide, it's okay, has done an analysis. So they have interviewed a number of, in this example, adolescent girls and young women. And out of that group of, let's say, 100 AGYW that have been interviewed, 70% know how to contact health facility management with an issue. And then you see the other indicators. So this is like your first sort of sense of the data has been analyzed. Next slide. And then we see this again. So this is another sort of an example of, you know, the story. We're starting to see a story. And then those numbers turn into percentages. And you now, okay, all of the issues are collecting. We can see the volume and we can see the percentage. Next slide. And then magically, we data turn into about what are some of the actual improvements that have that are a result of that advocacy using CLM data. So we see, you know, underserviced facilities now have multiple screening points because maybe the times didn't work with the AGYW group. We see hygiene improving, which actually makes AGYW feel comfortable going to the clinic, which then as in uptake of, as more of them are coming. And so we can see this story. Next. So now we ask the question, we have presented this data, so that we ask ourselves, and for you manage and are involved in CLM programs, we want to really ask ourselves, is this CLM data story clear to reviewing it? Is it compelling? Is it making you like wonder? And is it complete? So the ways that we assess this is all the findings being reported. So you have a set of indicators. Programs reporting on all the are things to point out about disaggregation. What was findings to CLM? Sometimes this is implemented, and sometimes very, very interesting for people to understand because it can help and how much work and the types of partnerships and collaborations that you're developing with different stakeholders. This is question, or not last bullet here. What was of these different stakeholders, and how has their behavior towards you as a CLM, how has that changed, improved, because now they see the value of this data, to see none of change, not just from the monitoring change service perspective. You're seeing changes to behavior towards the CLM itself. Oops, I see the video is still cutting. Sorry for this. Right. Can you hear me?
Yes, we can hear you, Sue.
Yes.
Great. Is there a next slide? Great. So this is a small picture. We are so busy collecting data. So this is, look at all of this data. There's tons of it. And then you have this other colleague that says, yes, but what does this all mean? Too much of a good thing isn't always a good thing. So we really need to make sure that our data is analyzed, because as this little caricature has, it says without meaning is just. So we want to make sure that our story is clear with this data, because then it just list. All right, just going to do a short section. So we don't know where, I don't know where you all are in your maturity level, but this is just a way to self-assess. Number one, is your program focused and effective? Are you doing at least cycles a year? Cycles? Because if you're one, then in some way, just then you're doing once a year, then that isn't necessarily CLM, because CLM should be systematic and routine. The next here is are all the data analyzed? And are data reports shared at each facility regularly? So they're not missing a data report after you've done the data collection. And are they discussed? So this is just another question to ask yourselves when you're self-assessing. And so it's like, are the health service sites getting the data? And are they also shared as appropriate and needed at other levels of the healthcare system? And are they receiving a positive reaction? Next one is, can you see evidence of service improvements? And the last is the story clear? And you will know if the story is not clear by the reaction you receive when you share the reports. So just think about this as you progress in your programmatic work. Next slide. So this is actually like my last slide, because I feel like we hear these words, maturity, sustainability, the same, is it not? What do we mean by embed? We mean institutionalizing CLM. What I would share with you is that just because you are in a program doesn't mean your program is sustainable. We need to be able to distinguish, have you reached experience, maturity? And if so, you can be ready. And maybe it's not, you have to reach all of it. Are you starting to be to assess yourselves on sustainability? And what we mean by institution, which is to CLM sustainability, we need to understand and check our programs in terms of these three areas. So where is it used? So if our program is so great and it is so, the data is, valued and deemed as very important, we can see that it is being used in a lot of important decision-making platforms and fora. So they could be program reviews, they could be helping to develop a strategy like targets and objectives. It could be part of community health strategy developing, and then your CCM and your Global Fund exercises, and then these other platforms such as coordination committees and technical working groups. So we need to understand, where is our data being used? It's so important that it's being used there. Then how is it? We look at how is it being used, but triangulate HMIS data, and then is it used to new policies, protocols, operation procedures, and human resource allocations, and all of these other things that you see here? Is it used to inform, and can we see evidence of that in our data use? And then lastly, we see the community partnership and engagement. So basically, we're asking ourselves, are these different making stakeholders, are they asking CLM implementers for their data? Are they asking CLM implementers to join these discussion spaces are being made? So we sort of wanted to give a bit a breakout of things that you can use to assess, and we can also assess, is this CLM program now starting to become on the track of CLM sustainability? Because a lot of funding, you can start to see that now are starting to really want, and this is also important advocacy and resource mobilization for these programs to continue. So a lot to discuss today. I'm really excited to have the additions of panelists because they have a lot of experience to bring on this topic. And then I'm really open discussion where hopefully we can do on-site troubleshooting and brainstorm now. So much, and I will hand it back to Ida.
Thank you very much, Suzanne, for this great presentation. We see that CLM is very important, and Suzanne showed us that data analysis is also very important. It's not only to collect data, but we need also to have a good analysis of the data with a story well written. And to move from maturity to sustainability, we also need to embed CLM, to institutionalize CLM, and also to see where our data are used, how it is used, and also we need to see community partnership and engagement. Thank you very much, Suzanne. I think now we will move to questions and answers. So for those who have questions, you can raise your hand and I will give you the floor. You can also put your question or your comment in the chat box, and Suzanne will try to answer to your question. I have one hand raised, Tamonu Siko William. Let me give you the micro. Yes, you can open your micro and speak. William Tamu Nosiki. William, are you here? If not, I will give the floor to Merci Moyo.
Good morning. Thank you so much. Can you hear me?
Yes, we can.
My name is Merci Moyo from Zambia, civil society. I just wanted to find out, I think when I was reading the concept note for this webinar, I saw something to do with how CLM can continue using the I think, the government's mechanism. But my worry was, if CLM has to be embedded in the mainstream government, how will the civil society operate if they are the ones implementing in collaboration with government? Right now, we know that there are certain CLMs that are happening in government, especially in Zambia. But the whole point of introducing CLM by civil society was to create a balanced approach to giving objectivity to CLM. I don't know if I missed in the presentation. Is there anything that we feel will be more successful if the CLM was under government? Because personally, I feel if CLM has to be integrated in the government system, then probably the objectivity may be compromised. So I just wanted to hear from you if anything has been discussed concerning CLM being integrated in the government. Thank you.
Thank you, merci. Susan, I don't know if you want to take all the questions before answering, or you will answer one by one.
Okay, Ida. Yeah, sure. Do we have time for that?
Okay, let us collect all the questions so that you can answer.
I mean, I'm happy to answer, but you let me know when is the right time to answer based on timing.
Okay, let us hear
to answer.
Okay.
So I'll respond to the Q.
Okay, good.
Okay.
Let us hear from William also. William, are you with us? Can you hear me? William Tamunosiki. We can't hear you, William. Okay, sorry, we can't hear you. I will give the floor to Abdul Malik and the Bugri.
Yeah, yeah, hello, good morning.
Morning.
Yeah, thank you very much for the opportunity. I wanted a bit clarification about the CLM. I think she made mention of CLM has to be routinely collected. And it's not just one-stop research, then you conclude and call it as that. I needed a big clarification about that aspect. So if community do their own research, maybe just a normal survey or research, how do we term that? Is that one to a CLM or is just community research? So I need thank you.
Okay, thank you, Abdul Malik. Yes, Suzanne, you can go ahead.
Oh, okay. So Abdul, I did not quite get, but I could maybe answer, so maybe you can put that in the chat. I can answer the one. So Mercy, you're speaking a lot about, I think you were speaking about that conflict of interest, government being involved in CLM and communities losing the objectiveness. Really what you're speaking to is losing that community independence and the community-led part of CLM, which is, you know, critical and important. I would just say to that, number one, resource available, which I can share on the chat, that deals specifically with COI, a conflict of interest, be a helpful resource after this meeting. And I would say to that is that there, you know, it's not a one all in terms of government, because as we move towards sustainability, that obviously will need to involve money, right? So if, you know, money, who is then these systems, and how do we at the same time maintain that independence? And so I think a lot of it depends on the relationship, number one, with the government, and number two, what is their role and how are they using that? And is it the right, appropriate to still allow those community-led organizations to maintain their independence? Perhaps in the CLM may be a collaborative. I can see that happening in the future, in the sense government will say a lot of trouble finding information about indicators. We really love for community to monitor them. It's different because communities should just monitor what they want to monitor. Particular scenario, collaboration with community help, that could be very positive. So I'll just stop there on that. There's a couple more questions over here from Matthew. I used in CLM. I would say I will give you my email after this, or Ida can after the webinar. A little on what specifically, because we have a lot of resources created under G6 and we're creating under GC7 and you into the correct resource, and then maybe we can just have a little bit of email back. So that's for Matthews. I see the second question here from Gennady. And I think this is right. What me, it's, maturity is one that influences absolutely. And that's what I'm looking at in terms of this, to me, actually speaks a little bit more towards your program towards sustainability. Because the CLM is influencing and changing the behavior of government because they see the information is so important. And to your other point, it's the community vision. Absolutely, it should. Empowerment. I think empowerment, fun, and leadership and representation. I feel you should influence your community vision and action. Next one by Mohammed. Is it possible to integrate one impact? Absolutely. We see that happening more and more. And it's not a you could that combines because this is the like the one impact HIV. You can add HIV questions to a same kind of digital app. There's others where you have one impact and then you have something else for HIV, but they're coordinated. So there's definitely ways. I can send you some examples of one impact taking on some HIV questions. If that's helpful, I can share that offline. And then I'm going to question from Gennady, just and I more. I can provide those examples later. Yes, integrate system. I think this we're moving more towards integration. What we mean by integration can be multi-disease, it could be one disease, human right. I mean, a lot of programs are already including human gender-related barriers. So we see a lot of that happening, and I can, again, examples. So I need to provide a lot of examples. And Ida, do you want me to stop? Because there's more and more sure of the time.
Yes, I think we will stop here and we can come back if we have a few minutes for you to continue to answer the question. If not, we will share the presentation with the participant, and if there are questions, we will share your email address so that people can address you those questions. Thank you very much, Suzanne, for this presentation. And now we will continue with a panel discussion with some community leaders who have some experience on the CLM. We will have 3 community leaders. We will first listen to Ange Mavula from ECOP in DRC, who will speak about us on achieving CLM maturity across HIV, TB, malaria, and human rights. And let us see project his presentation. Okay, that's good. Marina, just show me the profile of Ange again, please. Yes, Ange is the National Executive Secretary from Congolese Union of Organization of People Living with HIV. Thank you, Marina. Can we have now his presentation? Ange, Are you with us? Hein, tu pourras parler en français, mais la présentation sera faite en anglais. Je n'ai pas eu le temps de traduire la dernière diapositive. Tu pourras parler de ça oralement seulement. Ange will speak in French, and we will project his presentation in English. Welcome to you, Ange. For
Merci,
those who
Ida.
want to listen, you can go to the interpretation channel and choose, I think, and choose the French language, the English language. Oui, tu peux y aller, Ange.
Je disais merci, Ida. Bonjour tout le monde. Inutile de me présenter, je pense que vous avez suivi ce qu'a dit Ida. Je vais devoir dire un mot sur la maturité du CLM vers la durabilité. Quelques défis, boulot d'étranglement et puis les résultats. Je vais d'abord commencer par vous présenter la situation ou le contexte de la République démocratique du Congo, où il y a plusieurs acteurs de mise en œuvre du CLM. Nous avons UCOPLUS qui fait le VIH. Maintenant, on a étendu vers la tuberculose et le paludisme dans la logique de l'intégration. Le CAD qui fait la TB, qui va devoir aussi intégrer les autres pathologies selon ce que nous nous sommes entendus. Fondation Femmes Plus qui fait aussi les 3 maladies. Et puis, la coordination nationale de renforcement du système communautaire qui fait également les 3 maladies. Comme vous voyez, nous suivons tout ce qui est disponibilité, donc les ruptures en médicaments et autres intrants, tout ce qui est accessibilité financière et géographique. Par rapport à la qualité, nous voyons tout ce qui est formation des prestataires de soins et les supervisions. Nous suivons aussi par rapport à l'acceptabilité, donc tout ce qui est autour de l'accueil de bénéficiaires et autour du traitement, de leur traitement, et aussi le fonctionnement des organes, c'est-à-dire nous avons des organes au niveau des zones et des structures de santé qui doivent tenir des réunions. Est-ce que ces réunions sont tenues? Et les outils de gestion, justement, et des réunions et des stocks et tout autour des structures de soins. Le genre de droits humains qui est une thématique transversale qui sont suivis par tout le monde et dans toutes les thématiques aussi. Slide. Ce slide résume en fait le parcours du CLM en République démocratique du Congo vers justement ce que nous appelons ou nous appellerons la maturité. Nous avons suivi tous les 4 cadrans du CLM partant de l'éducation jusqu'au plaidoyer. Et sur l'éducation, nous avons justement travaillé avec tout le monde. Il y a des sensibilisations sur les politiques, les partenaires des soins et les organisations de la société civile. Nous avons tous ensemble essayé de sensibiliser pour que la conscience, en fait, sur la notion du CLM soit comprise par tout le monde. Et sur ce qui est de preuve, où nous avons aussi travaillé avec tous les partenaires. Il faut dire que en République démocratique du Congo, nous avons réussi à embarquer tout le monde avec nous. Quand je parle tout le monde, je vois le ministère de la Santé, pour lesquels non seulement ils sont représentés par les programmes nationaux, mais aussi le secrétariat général à la santé a pu désigner un point focal CLM qui est avec nous à tous les étapes. Et aussi les autres partenaires, dont Onucidal, MSF, tous les partenaires dans la lutte PEPFAR, bien évidemment, avant qu'on puisse gérer leur financement, qui étaient toujours avec nous. Et par rapport à l'engagement, nous avons mis en place des cadres de coordination à tous les niveaux, c'est-à-dire qui part du niveau périphérique, c'est-à-dire au niveau des structures, il y a des cadres autour de responsables de structures des soins. Au niveau de la zone de santé, nous avons aussi un cadre de coordination entre acteurs de mise en œuvre au niveau de la zone. Au niveau de la province également, il y a un cadre de concertation CLM au niveau de la province et bien évidemment au niveau national, où nous avons mis un cadre de consultation qui regroupe tous les partenaires et tous les acteurs de mise en œuvre du CLM. Et le plaidoyer aussi se fait à tous les niveaux et il est coordonné et embarque tout le monde pour pouvoir adresser des réponses aux problèmes qui sont euh, découverts ou par rapport à la chaîne de prise en charge des patients. Pour dire qu'ensemble, ici, nous avons harmonisé les sites d'intervention pour éviter tout ce qui est doublon et de sorte que nous ne puissions pas faire la même chose tous au même endroit. Nous sommes donc répartis les zones d'intervention. C'est pourquoi nous avons pu aussi intégrer les autres pathologies pour que chacun dans sa zone puisse faire les trois pathologies, suivre les trois pathologies au bénéfice des bénéficiaires. Et comme je le disais, tout se fait avec tout le monde et en continu, nous faisons les sensibilisations des communautaires pour que justement le CLM devienne quelque chose de routine. C'est vrai qu'aujourd'hui, ça demande de l'argent, mais déjà, nous sommes en train de constater que de moins en moins, il y a des financements pour la lutte contre le VIH. Donc, par ricochet, il y aura aussi de moins en moins de financements pour le CLM. Alors, il faudra que le CLM soit rendu comme une activité de routine, que ça soit une culture dans le chef des bénéficiaires des soins pour pouvoir remonter les informations qui pourront entraver leur accès aux services pour une vue meilleure. Vous ne l'avez pas à la dernière diapo sur le défi et le boulot d'étranglement. En fait, je disais que le plus grand défi, c'est arriver justement à rendre le CLM comme une activité de routine. C'est vraiment un défi, c'est vrai, nous avons, c'est l'idéal en fait, c'est l'idéal, mais jusque-là, ça reste un défi parce que la couverture même nationale par rapport au CLM n'est pas encore totale. Et pour le rendre vraiment de routine, ça sera pas aujourd'hui, mais c'est vraiment vers là que nous devons tendre. Le deuxième point que j'entendais aussi poser des questions sur la présentation de Suzanne, c'est justement la mobilisation des fonds du gouvernement, des gouvernements nationaux. C'est le souhait, mais c'est encore un défi. Connaissant déjà comment nos gouvernements fonctionnent, connaissant déjà ce qu'ils ont fait au vu du gel de financement américain, nous pensons que ça sera difficile, mais c'est encore un défi, mais il faut en arriver là. Si nous arrivons à mobiliser les fonds domestiques pour les CLM, nous pensons que nous aurons atteint la maturité. Je parlais de la couverture géographique. Et par rapport aux résultats, je n'ai pas présenté les données, mais au moins, comme nous sommes en train de, nous avons passé l'étape d'évaluation du CLM avec la revue du programme mondial. Et parmi les résultats, nous avons constaté que sur les trois derniers trimestres que nous avons passés, il y a 0 franc qui a été payé pour l'accès aux services par les bénéficiaires, ce qui est vraiment une réussite.
Allô, Ange, on t'entend plus. Ange, tu es là? On t'a perdu. I think Ange has some connection problems. As we are a little bit late, we will continue with the next presenter. The next panelist, maybe Ange will come later. So we will now listen to Morgan Shinona from FACT Zimbabwe. He will speak with us on adapting CLM mechanism to respond to emerging crises and changing need. Yes, can we, Morgan, welcome to you. Thank you for your availability. Yes, you have the floor now.
Thank you, Ada. Good morning, everyone. Thank you so much for joining in. I'm waiting for the presentation to be beamed. All right. Thank you so much. So I'm going to speak to adapting community-led monitoring mechanism to respond to emerging crises and changing needs. Specifically speaking to our experiences in Zimbabwe. Kindly confirm if you are hearing me.
Yes.
Yes.
Okay, thank you so much. Next slide. So I think as an overview, you have already heard about what CLM is all about. So this is where service users, communities, monitor services, especially around availability, accessibility, and all those other indicators of your service quality, also, and things to do with effectiveness of these programs, even of the interventions, availability of services, and also even affordability of those services. So as we do these processes, we also need to be adaptive to changing needs, especially in times of crisis, COVID-19 as an example, shifts in funding priorities, all that will require a CLM program that is flexible and adaptive to those changes. So I'm going to speak to some of the changes that we effected in our program during COVID-19, and also recently we are working on additional adjustments as we look at shifts in the funding landscape. Next slide. So these are some of the things that we have done. We have started implementing CLM in GC6, that is 2021 to 2023. So that was the time when we also had COVID. So we had a number of adaptations that we have made to make CLM work in that context. One of the things that we have done was to adopt digital kind of CLM, where we are working using tablet phones to minimize physical contact during that time of COVID, you know, keeping distance and also avoiding further infections. So we adopted tablets. Thanks to the Global Fund, they supported us with tablets, phones, and these were very useful during that time. Then we have been supporting, and we are continuing to support our community health monitors with data so that they'll be able to make use of these digital applications and gadgets, so they can submit their data virtually without any physical contact. And it also helps in terms of real-time data submission. Then integrated COVID-19 questions. So because COVID came as a layer that was also disrupting sales provision, we're concerned about HIV, TB, and malaria, but COVID in itself was also an issue that was disturbing provision of services along those three diseases. So we integrated some questions around COVID to check also how COVID was impacting on access to HIV and TB services. Then we also shifted, of late we have shifted from quarterly data analysis to weekly data collection and analysis, so that we can keep daily trends in terms of what's happening on the ground, especially given the recent changes in funding landscape. Would want also to track and monitor everyday experiences of communities in terms of how are they accessing their services, especially people living with HIV. We have seen a number of changes from where they used to get services maybe within the communities through some differentiated service delivery models. We are now seeing more people coming to the facilities, and we have been seeing long queues and so forth. So these are some of the things that we are trying to monitor on a daily basis, but of course we do our analysis on a weekly basis. So this is adaptation so that we can see and address real issues on real time when they happen. We have also tried to decentralize our data analysis. You know, when we started, we used to do data analysis at a central point where at national level data was received and then is analyzed, and findings are then communicated downwards to the districts and facilities. But now we have capacitated our district officers and community health monitors to do some bit of analysis at their own level so that they can also engage. This is also helpful even in the context of emergencies like COVID-19. It means they will be able to do some analysis at local level and engage with the health service centers to resolve any issues that may be coming from their own context. Then of late, we have also trying to push through CLM issues into national discussions. So currently in Zimbabwe, there's a discussion around national health financing and also national health insurance. So we pushing the CLM data, CLM evidence into those dialogues. And recently we had a dialogue with the Ministry of Health and Child Care and other stakeholders, where we are presenting evidence from CLM on issues that needs to be addressed as we discuss the national health insurance and other funding possibilities to support HIV, TB, malaria, and even general health service delivery in the country. Another adaptation that we have done was when we started, we used to have very long data collection tools. We were doing some surveys. So we listened to the feedback that we were getting from communities and even from our community health monitors to say that our questions were too many and people didn't have enough time to respond to them. So as a way of adapting, we have also reduced the number of questions. In fact, we revised our data collection tools to reduce the length of time that one would take interviewing our health service users. Then what made it possible also to do this, I think one major factor was being adaptable, being flexible, responsiveness, just listening to the community's feedback. And then we made some adjustments, especially on the length of our data collection tools. We are also seeing increasing buy-in from our key stakeholders, which was not there when we started, but of late, we are getting more buy-in at local level in terms of supporting the CLM program. Then we are also getting additional support from other supporting agencies who are interested in CLM, like GIZ and International AIDS Society, in addition to what we are getting through the Global Fund. So this has made us and has allowed us to do some adaptation that we have done so far. Next slide. So emerging innovations in terms of how we can keep CLM relevant and responsive in terms of crisis. I think there was a talk already earlier on in this discussion in terms of how we can leverage on digital platforms. So we are looking forward to come up with a real-time digital platform where CLM can be more effective, especially during emergencies where real-time data can be shared, issues can be also addressed in real time. Currently, we know there is one impact. There's also a platform called Kutabila, which is housed by Zimbabwe National Network of People Living with HIV. Those are some of the platforms which we think may need to be incorporated into CLM so that they can be useful and make CLM a real-time process. But we are also looking at maybe an additional platform if that can be supported, and we are looking towards doing this with the support that we are anticipating from some of the funders who have promised to support us. Then CLM is also helping us of late. Like I said, we are now doing weekly data analysis and updates. So this would be very helpful in terms of giving situational reports of what will be transpiring on the ground. And this is also something that can be very useful during crisis and emergencies. And it also helps us. So with the data that is being collected through government systems, there's more inclination towards statistics and quantitative analysis of issues. But with CLM now, we will be able also to add a voice, to add also to put a human face to issues that will be coming from the ground. Then we are also, we have tried to adopt an inclusive CLM process where we don't necessarily single out particular groups, but our CLM is inclusive of all sub-population groups. We have people living with HIV, we have LGBTQI, we have MSM, we have sex workers, we have adolescent girls and young women. This is an innovation which is meant to circumvent also backlash in some instances where some communities are not well embraced at the moment, but with an inclusive approach, you will be able to present issues that are affecting all those subpopulations without necessarily attracting retribution and backlash. So this is something that we are doing, but we have also incorporated some customized tools within that, where we have specific tool for people living with HIV, where we also ask specific questions to different subpopulation groups, but we don't present it as a specific population kind of CLM, but it's an all-inclusive CLM, so that we manage stigma and discrimination as well. And also towards sustainability, we are working with our national stakeholders to look into how we can come up with and finalize the national CLM strategy. We have started this work earlier on, working together with the UNAIDS and other implementing partners were supported by USAID. But unfortunately, that process has stalled at some point, but we are looking forward to come up with a national strategy on CLM, which will also help us to embed CLM within the national processes and also influence even funding at some point. So we are looking towards doing that. Then we also have a CLM National Steering Committee, which helps us in terms of guiding and also taking issues upwards from the facilities, from the districts for national level engagements on issues that needs police attention. But in addition to this, we have also worked with our other civil society partners to present these issues through Zimbabwe AIDS Network. We have been presenting CLM issues during their chapter meetings, which are done quarterly, and we are looking forward to participate at provincial level meetings by Ministry of Health and National AIDS Council, where we would want to present issues coming from CLM. I think this is my last slide. I thank you.
Thank you very much, Morgana.
Yeah, so sorry, just also to highlight how we are working
against time. Yes, just 1 minute, please.
Yes, so in terms of how we are maintaining the voice of the marginalized, we are working with the health center committees at facility level. So these are institutionalized structures, and we have made sure, and I think by its design, there's representation of all the subpopulations, sex workers, adolescent girls and young women, among other key groups. So this will keep the voice of the marginalized in play even during emergencies. Thank you so much.
Thank you so much, Morgana, for this great example from Zimbabwe concerning the adapting CLM to crises and needed. We see that we have many examples like leveraging on digital platform during crises and also shifting from quarterly to weekly data collection Thank you for this example. We will now move to another speaker, which will tell us a cross-cutting role how to do maturity and adapting of CLM across contexts. And for this, we will listen Igor Gordon, a program team lead in the Eurasian Harm Reduction Association. He is an expert from ICA. Yes, welcome to you, Igor.
Yes, hi, can you
Yes,
hear
you
me?
have the floor.
Can you hear me?
Yes, we can.
Okay, good. So yes, hello, dear colleagues and friends. Thank you, Ida, for this presentation of me. Today, I'd like to share some reflection from our ongoing efforts on CLM across the Eastern Europe and Central Asia region. But before diving into the today's discussion topics, I want to highlight a key milestone, what we achieved. In early 2023, all regional community-led and supporting civil society networks developed a joint community position on CLM in our region. This was a really critical step forward, maturing CLM as a tool genuinely rooted in community leadership. I will share here in the chat a link to this position. So together we built consensus on the definition of CLM and its core principle. The management of conflict of interest, what we are talked about today earlier, and the essential conditions for sustainability. One foundational principle stands out. CLM must be initiated and owned by the community at all stages, from priority setting to data collection, analysis, and advocacy, with full respect for independent safety and local representation. And I think this outcome is really powerful because communities themselves now own the framework for what CLM should look like, not imposed from above, but shaped by lived experience. Next slide, please. Yeah, but now let's talk about what's blocking us and what's pushing us forward. As many of you may know, in the eco region, the legal and policy environment has significantly worsened in recent years. Full-scale war initiated by Russia against Ukraine, the adoption of restrictive laws targeting civil society, such as foreign agent regulations, anti-LGBTQI propaganda laws, and limitation of freedom of association and assembly, have created multiple challenges for community-led organizations, along with serious risks to the safety and freedom for those engaged in advocacy and policy change. Add to that the growing trend of donor exist strategies, and the reality becomes even more complex. Yet, despite these threats, we also see progress. Even in restrictive settings, community-generated data can shape services, expose critical gaps, and influence decision makers. Let me give a few concrete examples. So, supported by IHRA grants, we have gained the results in Moldova, CLM led to Kyrgyzstan. Findings helped revise national protocols and introduce long-acting medication. In Kazakhstan, CLM was successfully funded through the Global Fund grant, which is for our region is a big achievement. And achieving CLM maturity in constrained settings is fundamentally challenged by two forces in our region. First, this is shrinking civic space, and another short-term donor-driven models. In some countries, political repressions make it really extremely difficult for communities to operate. Meanwhile, CLM is often viewed as a temporary reporting task, not as a long-term accountability mechanism. Yet these environments also reveal a deeper truth. CLM becomes a form of resistance and empowerment for communities. So even minimal data collection, when truly community-driven, can uncover a service gap, document human rights violation, and push change. We saw this with take-home OET expansion, for instance, in Moldova, and protocol reforms in Kyrgyzstan. So what we should do, we must reframe CLM not as routine and bureaucracy, but more as essential community infrastructure for survival, for voice and influence. Please, next slide. So what can we learn from one another? Cross-regional learning requires deliberate facilitation and shared language. At our organization, we've seen the value of building multilingual peer-led community of practice. Let me share in the chat link to this community of practice, what we have. So where activists from different countries can share lessons, tools, and strategies. So we organize it regularly, meetings, online meetings. And for instance, monitoring during wartime in Ukraine taught others how to collect data in crisis conditions. And Georgia work integrating CLM into OIT clinics inspired similar reforms in Kyrgyzstan. So community can, in this community of practice, everyone can pose a question, and all together we are discussing different topics, really very different connected to CLM, what is important for communities and for people they want to know more about. And when we move away from exporting preset models and instead co-develop tools, CLM become more flexible, localized, and sustainable. Another opportunities what we practice, this is study visits, joint trainings, and peer mentorship. Not top-down technical assistance, but all that create the condition to real exchange and mutual learning. Now, the big question, how do we sustain CLM when the donor cycle ends? So we have a lot of discussions here in the chat, but I think the answer, there are three important things: invest in people, invest in platforms, and invest in policy influence and advocacy. People first. There is need to build long-term capacity, not just for data collection, but for leadership, analysis, and advocacy. In our region, we've trained dozens of community members, and as a result, now CLM team use hybrid tools, different tools, digital service, paper forms, mobile apps, not the preset models, but really they choose what they need to collect real time data, including in hard to reach settings like in Prism. Second, platforms. I think it should be a practical digital infrastructure that helps communities document, store, and use data securely and independently of donors and governments, even though they should be integrated into the healthcare systems, but it should be independent system. I'll drop some links here in the chat. An example of what we did in this direction. Let me just provide you a link. Here you are. So this is a handbook on CLM tools and web-based tool that helps communities to choose the best method based on available time, money, and human resources. So together it offers 106 different variations of CLM, adoptable and universal. And yeah, and you can use it, everything is in English and Russian. And third, policy influence. So CLM findings must be used in real decision making. Investment in advocacy for embedding CLM international strategies and funding frameworks. So it is not longer a pilot, but a funded part of the health system. But this is also required a sustained political advocacy to protect civil space, promote transparency, and institutionalize community power. So we should fund advocacy as a tool for real changes. And let me leave with you with three key messages. So CLM maturity is not about more paperwork, it's about real community ownership. Sustainability requires long-term commitment, not fragmented short-term grants. And we must embed CLM into DNA of national health system, not just into the project reporting templates. And thank you for this opportunity. And if there are questions, I'm ready to answer, and I'm ready for further discussions. Thank you.
Thank you very much, Igor, for this great presentation on adapting CLM in constraint environment with a good example from your countries. And we see that CLM can help really people to access services in constraint environment with this example you gave to us. Thank you very much. I think we will now move to another session, an open discussion on the following objectives to encourage, to explore challenges and bottlenecks that hinder achieving CLM maturity and embedding CLM in national process. And also we will see how to identify community priorities and needs of community to support the advancement of CLM programs to achieve maturity. We have some resource person here. We have still Susan, specialist from community-led monitoring from the Global Fund. Maybe we can hop on the discussion who want to take the floor, and also maybe Susan will like to come back and speak about how to identify, how to explore challenges and bottlenecks. We have seen the example from Zimbabwe and also from ECA region and from DRC. What can you say, Susan, about all these examples and how to achieve maturity?
Hi there. So I hope you can hear me. I think that where I am, my network is unstable, so I apologize for that.
Okay.
I think it's really, really important to actually hear these examples because they give a real sense of what is happening and how our community organizations are delivering this very complicated, but not so complicated intervention. And so I feel like the perspective based on the country context that each one of them have provided are really interesting. I do encourage, because we are short of time, I do encourage that you follow up directly with these presenters, because one of the things that we really want to encourage by the Global Fund is peer mentorship. We now have many, many more experienced CLM implementers. And for us also to be sustainable, as one of the presenters said, we don't always need this TA, right? You are the TA providers. You can help each other with the experiences that you have. And so I feel like we can create this sort of like community of practice around these issues. And so let's make sure that we keep in touch, and we don't need to have deliberate webinars to do this, since we have our different email addresses. And I can certainly put you in contact with different presenters and CLM implementers to be able to do that directly. So that would just be a very quick intervention. I'm not going to comment on the interventions themselves because I feel like they speak for themselves. Thanks.
Thank you very much, Susanna. Thank you. So thank you for your availability. I think as we don't have enough time, we will move to the next session with Ika Noviandi to do the closing remark. Ika is a coordinator of youth leads, and she is part of 7 Alliance. Ika, you have the floor.
Thank you so much, Ida. I hope you can hear me.
Yes, we can.
Good afternoon, good evening, dear colleague and partner. Thank you all for your active participatory into this webinar. This has been a rich and insightful discussion filled with practical example and reflection that underscore just how far we've come and how far we still need to go in embedding community-led monitoring into national system, despite the challenge that we all face in regard to the declining the global financial landscape. What we've heard today reaffirm that CLM is not just a tool, it's a movement. In my opinion, it could be one of the legacy came from the community-led response of the HIV, since it is rooted in the community ownership, driven by lived experience, and grounded in the human right to health. From the country example shared by our speaker, we have seen how CLM can adapt, innovative, and remain resilient even in the challenging context. But we've also heard that hard truth, sustainability is still fragile. There is a clear need for greater political will, stronger governance, flexible funding mechanism, and also recognition of the essential role of a well-supported, fairly compensated CLM workforce. And importantly, we must continue to push CLM to be integrated not into just in HIV, but across TB, malaria, and broader health system. As we move forward toward challenging situation, let us carry today's energy and learning into our country level advocacy. Let's turn maturity into momentum and momentum into institutional change. On behalf of the ASEAN Pacific Network, on behalf of the Asia Pacific Learning Hub and also the Seven Alliance, I would like to thank the Francophone Africa Learning Hub for hosting, the speakers and panelists for your valuable insight, and all participants for your commitment and contribution. Let us continue this conversation, this collaboration, and this movement until CLM is no longer a project, but a permanent part of how health systems are held accountable and made better for all. So thank you. Over to you, Aida.
Okay, thank you very much, Ika, for this closing remark. This has been a very interesting webinar. Sorry for the beginning. We should have had interpretation in other languages, but because of technical issues, we don't have the opportunity to do it. But we will share the slides and the recording and also a summary of the webinar soon to all the participants. I think we have some good example of CLM that can be reproduced in our countries. What we can retain is that data collection, data analysis is very important, as Susan said. It is not only to collect data, but we need to have a good analysis of the data that can be exploited. And also good example from countries. Ange showed us how to achieve CLM maturity with the example of DRC, where we have, we need to do training. Training is very important for our communities leaders to have choice of indicators and also to develop a good guide. We have also commitment. We shall be committed and have coordination framework. And then when we collect data, we need to have good advocacy framework at all level. And resource mobilization has been mentioned also. That is very important. From Morgan, we learned that we need to adapt CLM into crisis, mainly when we had C19 RM. We need to adapt tools, and also we can replace, you can leverage on digital platforms and also integrate some question into the CLM, like the case of COVID-19, and shift from quarterly to weekly data collection when needed. And from eager, we learn also how to adapt CLM in constraint environment. For that, we should invest in people. We should also invest in platform, have a digital platform. And Susan, tell us how we can really move to maturity with CLM. And the Global Fund team, CLM team, is available for any community that needs some information. We will share the slide recording, and also we will share the email addresses to those who want to have more information, to have who have more questions. Susan posted her email address in the chat box, and also we will share all the information related to the webinar. And so I would like to thank you all for your attention, and see you next time for the joint webinar that will be organized by all the Learning Earth. And thank you for my colleagues from other Learning Earth. Thank you for the translator. Sorry for the technical issue. See you next time.
Thank you so much, Aida, and thank you,
Thank you.
colleagues. Next
Merci
time.
beaucoup, Ida.
Thank you. Bye-bye.
Thank you. Bye.
Bye.